The nervous system regulates and coordinates the body's activity and response to stimuli. There is a complex network composed of the neurons, the spinal cord, and the nerves, and two divisions of the nervous system, or the central nervous system, which include the brain and spinal cord, and the peripheral nervous system. The central nervous system processes and stores sensory and motor information and oversees or controls the state of consciousness. There are 12 pair of cranial nerves beginning in the medulla oblongata, and the central nervous system includes the frontal lobe of the cerebrum, which controls the intellectual functions such as thinking, um, remembering, deciding, and personality. Coordination, equilibrium, and posture are are controlled by the cerebellum, and the hypothalamus regulates hormones from the pituitary. And medulla oblongata has the regulation of the heart, blood pressure, and respiration. Nervous system, the peripheral nerves connect the spinal cord and carry information to and from the brain and the spinal cord. The sensory nerves give us the impulses to the body from the spinal cord and the brain. The motor nerves transmit impulses away from the CNS and produce the responses in muscles and glands. And this system contains 12 pairs of cranial nerves. The nervous system contains four major blood vessels, and they're affected to supply the brain and with oxygen and nutrients. These include the two carotid arteries and the two vertebral arteries, um, and the two anterior and posterior communicating arteries. The neurological assessment is a step-by-step collection of data um, to evaluate the neurological status and the cognitive function of a patient. It's done after head traumas, cranial surgery, um, neurological disorders like a brain tumor or a stroke, um, and it can methods that are used are to take a medical history, test their speech, their language, their writing skills, test their cranial nerve function, their strength and tone, their coordination and balance, and their sensory function, their whether or not they have a increased or decreased amount of sensation response. Some common problems and symptoms we see in the neurological system are headaches, dizziness, muscle weakness, tremors, difficulty with movement or paralysis, uh, pain radiating from or to a direction, and memory impairment. Some additional problems that might be seen that would require evaluation are altered levels of consciousness, um, drowsiness, sensory disturbances or numbness, sense of feeling and loss of feeling, and those kind of things, and speech and visual changes. Because of the complexities of the central nervous system and the peripheral nervous system, damage in either one can cause a lot of various signs and symptoms. Some of the other problems that you see are vascular issues or circulatory deficits, and these are reductions or inabilities or decreased abilities, injury, of infection, uh, things that are inherited defects, congenital defects, things that are there from birth, degeneration over a shorter, longer period of time, and tumor. The cerebrovascular accident or stroke happens when the brain's damaged by sudden disruption of blood flow. It can be from a clot, or it can be from a bleed in the head. So either of those can cause a stroke. It's the biggest cause of adult disability, and anyone having the symptoms of a stroke should automatically be evaluated. So if you're dealing with a patient with those, that would be your cue to make sure um, they're evaluated quickly. Um, in your book, there's a reference to FAST method that you would need to know. Um, and these are led up to by diet and lack of exercise and smoking, obesity, the family history, all those things lead into potential of a stroke. Um, and in a physical exam, if a physician suspects a CVA, then they're going to look at things like their function and their impairment levels. So, common symptoms we would see in stroke are a sudden severe headache, aphasia, that's difficulty talking, or dysphagia. Uh, uh, Aphasia is the inability to talk, dysphagia is difficulty talking. um, Sudden weakness, numbness, paralysis, especially if it is on one side of the body, uh, sudden confusion or loss of vision, blurred vision, all can be signs, dizziness, loss of balance or coordination, all of these, and especially if you have multiples of these, would be a real concern that this might be the issue. There's three vascular problems that can cause a CVA or stroke. Occlusion of an artery by a antheroma, so it's a fatty plaque that blocks the artery. Uh, Sudden obstruction by an embolus, that clot that moves, and then a cerebral bleed, a vessel breaks. Long-term treatment for CVA or stroke depends on the size of it, the location of where the stroke happens, what part of the brain is involved, and if there's any impairment or the severity impairment. The goal is to get their functions back and treat them for the underlying disorders, and you want to work with that very quickly. Recovery rate of improvement or the degree of rehabilitation. Some of the disability becomes permanent even after rehabilitation efforts. So even if you really rehabilitate, you may not get them totally back to normal. Preventive stroke is those positive lifestyle changes and controlling the risk factors and knowing warning signs and educate family members on the warning signs that they might see in this patient. So immediate intervention within 3 hours will limit potentially some of the brain damage that might be long term. And that's things that we would do, have them chew an aspirin. Uh, they may also need surgery to improve their circulation, remove a clot to clear that blood flow. Surgery to repair a broken or bleeding blood vessel, and medications to prevent or reverse brain swelling may all be used, depending upon what type of stroke they've had or what the cause is.